Hi everyone, welcome to Raaonline. Lumbar puncture has been performed for this patient and the sample was sent to the clinical microbiology lab and the preliminary examination showed the following findings. So what are you able to see here? So it is going to be an example for negative staining method. So the stain which is going to be used is going to be our India ink or nigrosin stain. So these are the example for the negative staining method. So here like we are going to use this particular staining for demonstrating the capsule which is present around the particular organism. So here you are able to see the particular yeast and there is going to be a clearance or halo around the particular yeast. So like this is going to depict us in picture. The patient is going to contain this capsulated yeast in their CSF specimen. So example for capsulated yeast which is going to cause meningitis is most commonly is going to be our Cryptococcus species.